guest this morning is our county manager, Mr. Vincent Jones, and of course, Dr. Brake, who is the public health director here in Warren County this morning. And as I told him this morning, this project was just dropped in my lap this morning. So I really normally I have a lot of paperwork and stuff, questions and answers and things of this nature, but I don't have that this morning. So what I am going to do is so I'm just turning the program over to them and let them go. If you have any questions that you would like to ask either of them, I invite you to give me a call. Area code 252-257-5557. Once again, 257-5557. I'm going to say good morning to our county manager this morning, Mr. Vincent Jones. Good morning.
Good morning, sir. Thank you for having us.
Good morning. Glad to be here.
Good. And you can blame us for dropping this.
That's no problem. We don't want to do this.
I hear you. But we felt it was important that we come and talk to our Warren County residents. As we have been responding to the pandemic, we've tried to come here periodically to WARR to make sure we keep, like I said, our residents informed and make sure everyone is aware of what we need to do to keep safe here in Warren County. So, as you know, we're in the middle of responding to the COVID-19 pandemic, and it has impacted Warren County, and we want to make sure that people know of the different ways that it can impact them, and it has been impacted the county while we are trying to keep as many of our residents safe as possible. And so we know that our residents know that we have first responders, and that includes our fire departments, our sheriff's deputies, and last but not least, our emergency services and paramedics who are responding to calls. And all of those first responders are putting themselves at risk when they go out and expose themselves to the community to try to keep people safe or to perform rescues when people need their help. Because, as Dr. Brake will tell you coming up, we're in a situation where it's become tougher and tougher to track where people are getting exposure from. And so that means that we're seeing what's called community spread. And that means we all need to be safe. And I know the weather is getting warm and people want to visit their family. And we've been under a stay-at-home order for a few weeks now, and people are getting restless. But we have to please ask people to, if at all possible, stay home, try to observe social distancing, because you're not only keeping yourself safe, but you're keeping your family and loved ones and other members of the community safe as well. And so we wanted to come today to talk about a few things related to that. All right. And so, Dr. Brake, you can just join in and talk about the things that you want to make sure that we convey to our residents.
Okay. Thank you, Mr. Jones. First of all, I just want to start by thanking our residents who are following the governor's stay-at-home order, as well as Warren County's curfew, and also practicing the prevention measures that have been put out. We know that these strategies work and that they help to slow the spread of COVID-19. We also know that it's even more important now that we follow the public health guidance, because we know that individuals may contract the virus, but they don't have symptoms. So therefore, we must act as if anyone we come in contact with might have the virus. So for Warren County, we had our first case of COVID-19 on April the 3rd. And since that time, we had 3 positive cases as of April the 6th. So from April the 6th until Monday of this week, we went 21 days without having a case. And so I just want the residents to know that as more people get tested, we will continue to see more positive results. And with that said, we should not be alarmed by that, but understand that, as Mr. Jones says, we need to be even more diligent in our efforts to prevent others from becoming exposed to COVID-19. So as of this morning, we have 15 confirmed positive cases of COVID-19 in Warren County. We know that 110 residents have been tested, and we also suspect that we have many more residents that have been tested, but the state does not require providers and labs to report negative tests. So they're only required to report positive tests. So we do believe that we have other residents that have also been tested. And the majority of that 110, 94 are negative results. So the current cases that we have appear to be spread across the county. We have one individual who is in the hospital, and the rest are recovering at home. We also have our first instance where individuals in one household tested positive. So Mr. Jones talked about community spread, and that is people are getting sick and we don't know the source of their infection. So we really want people to continue to focus on the prevention efforts of frequently washing your hands, covering your cough and sneezes, avoid touching your eyes, nose, and mouth. Practice social distancing, encouraging people to stay away from folks if they don't have to be in close contact with them. Staying at home if you're sick, even if you have mild symptoms. And then if you are feeling sick, to call your doctor so that they can advise you on how you need to be treated. CDC has also recommended wearing face masks in public, particularly if you are someplace where you're not able to maintain social distancing. So we just want people to be mindful that we need to continue practicing those measures, and we also need to continue to follow the executive orders that are out there.
I want to jump in here very fast. As I said, as questions come to me to ask you, I have to go ahead and get it on. Go ahead and do it. I hear you talk about testing. In several of our large cities, they have announced different sites that they do these tests at. So are we waiting for people to become ill and we get the report back from their medical records that they have been affected? Or for those of us who may not know, is there a place here in Warren County that this testing takes place at?
Okay. Well, the trigger for testing has typically been to call your doctor.
Okay.
And then your primary care doctor will advise you on whether you need to be tested. I will say, though, that part of the efforts from Secretary Cohen is to increase testing capacity across the state. So while we may not be doing mass testing right now in counties within our region, we are looking at capacity for increasing testing across the state. And that's something that DHHS is leading and working with local counties to do that.
Thank you very much.
Okay. So Dr. Brake, I think, mentioned the issue of using our masks. And so should we talk a little bit about, or can we talk a little bit about masks? What masks are acceptable? Like, I have my disposable surgical mask, but we also know that people can now use cloth masks and bandanas, anything to help limit, I think, the spread of the virus.
Yes, and that is true. So the general public can use surgical masks if they have them. Many of you have been hearing on the news that personal protective equipment has not been as readily available as we would like in the state. So the general public can use those masks. They can also use homemade masks, and I'll just give a shout out to those churches and other individuals in the county who have been making masks and providing them to our first responders and to others in the community who may not have a mask. I also have a cloth mask that was made by one of the nurses at our health department. And so we do encourage people, if you're out in the public, that you can use your cloth mask while you're out. And this is especially recommended, as I mentioned, if you're out and you're not able to social distance. So if you're in the grocery store and there are people there and you feel like you need to have more safety measures in place, you can wear your mask there. So I have observed that many people in Warren County are wearing masks while they're out in public, and that is one of the prevention strategies. So we do encourage that.
County Manager Jones, do you see with the curfew that was put in effect here for Warren County, do you see that? Do you see the effects of that as far as, if it's going well? How things look?
Okay, sure. So I try to observe the curfew and to make sure I am in by 9 p.m. But when we instituted the curfew, the board thought that was a good way to have people realize the importance of us trying to stay at home. And so one of the things that we have done is we've asked the sheriff, because they've been out monitoring.
Okay.
And the sheriff has reported back to me that he felt as if we were getting good compliance,
All right.
that our residents were trying to observe the curfew, that we're staying off of the road. But the longer it goes on, I think the more people are getting, ready to move outside of the quarantine and outside of the cabin fever is the word I'm looking for.
Yeah.
And so we have to just guard against that. And because we know we're in a situation where this can be spread by anyone in the community, and many people may have symptoms or not show that they have symptoms, we just need to be on guard. We are a rural community. We have limited access to health care, and we don't want to find ourselves in a position where we are unknowingly, unwittingly spreading the virus throughout the community. And so we just want to, again, just take this time to encourage people to please keep each other safe and try to stay at home, and follow the practices that Dr. Brake has just talked about for mitigation.
Thank you very much.
Okay, and I also just wanted to add, I know that in the news recently, our residents may have also heard that the list of symptoms for COVID-19 has also expanded. So originally we were talking about having a fever, having a cough, shortness of breath as being the primary symptoms, but now that list has been expanded to include chills, having repeated shaking with chills, muscle pain, headache, sore throat, and then a loss of taste or smell. So these are some additional symptoms that have been added. So just want our residents to be aware that many of these sound like symptoms of the flu as well.
That's where I was going to go.
Yes,
Yeah.
sound like symptoms of the flu. So that's why we're saying to individuals to call your doctor first, because we know some people have allergies during this time of the year, and so if they have a cough, it might be related to that. If they have a fever or chills, they may test for the flu and all of those types of things. So it's very important to just make your first contact be your primary care provider, so they can help assess what kind of testing they feel you need.
And we need to let everybody know out there that, you know, when we talk about these numbers, a lot of people, first thing they want to think of is Warrenton. But it's not Warrenton, it's Warren County.
Yes.
And that makes a big difference. And we have a whole lot of different counties within this county, I guess, a lot of different communities there.
Right.
Within this county.
Yeah, we have a lot of different communities,
Yeah.
and then also, if you look at the data for our neighboring counties, so Warren County, we have 15 confirmed cases, but our case count is very low compared to our neighboring counties. But we also know that we have residents in our county who work in Vance and Franklin and Nash and Halifax and all of those other counties. So we all have to be mindful, you know, as we move back and forth during our day, going to work, that we are putting ourselves in contact with people who are coming from other places as well, which is another reason that we really just have to make sure we follow the prevention strategies to help keep all of us safe.
Thank you very much.
So that, I think, covers most of what we wanted to do today, is to make sure we again just brought this and kept this at the forefront of people's attention here in the county. We're trying to do our best to make sure what we are doing on our end can keep people safe, and now we need to make sure that we ask our residents to help us out and that they do their part in trying to keep each other safe as well.
Sort of a question for the long run, or down, you know, the way coming. How do you think that this is going to affect our moving about in the coming months, in the coming year? How do you think this may affect us as a community?
Well, I
Sure,
think
you know
we've
that.
heard references to our new normal. I mean, that's something we all hear a lot on TV, that we have a new normal. But I think it will affect how we move around and how we connect with people in our community. Because there is no vaccine for the virus, we have to continue to be cautious about our interactions with people. I mean, even now as the weather is warming up, and even if the governor's executive order is not extended past May 8th, I would still say we really still have to be careful because we have vulnerable populations in our county and we need to make sure that they are safe as well. So I would just say to people, please continue to follow the guidance. Stay at home if you don't have to go out. And if you test positive, by all means, follow the guidance that you're getting from the health department as well as your provider. Because you definitely don't need to be going visiting mama or going to see Aunt Lucy or visiting your cousin if you've tested positive, or even if you have mild symptoms, if you are sick. Definitely should not be reaching out and visiting folks at this time. I think social distancing has proven to work across the state and in Warren County. So I think we have to continue those measures to try to keep people safe. Wear another face mask, all of those types of prevention strategies. We have to continue to keep those in place. I think we're going to have COVID-19 for the long haul. I don't think it's just going to go away because we don't have a vaccine. So I think we just, in our minds, have to continue to think. We have to be careful, and we have to continue with the strategies.
Right fast, because I know you got to go. Once again, we know that there is no known cure right now for it. But can you give us sort of an insight maybe on what might be some of the maybe over-the-counter medicines or something that, other than you already said, if you feel any of these symptoms, contact your doctor.
Right.
But is there any over-the-counter medicines that we may be able to use to sort of help us do this? Anything come to mind?
Well, I would not say specific over-the-counter medicines, and I think the reason why the guidance is to contact your primary care doctor first is so they can assess your symptoms and then recommend some type of treatment for you if you need to have treatment. So right now with COVID-19, basically what is happening is the medical community is treating the symptoms for it. So
I had to ask that because there's a lot of news out there, information that says you can go buy this, you can go buy that.
That's true.
So I wanted an expert, sort of come in and let us
don't
know.
use disinfectants. I know that people have been talking about that, but that is not true. And basically, again, call your doctor because he or she can help you best assess what you need to do in terms of treatment, but also in terms of testing.
Right. And I agree with Dr. Brake. We don't want people sort of self-medicating.
Right.
Call your doctor and to be sure that you can get treatment that's appropriate. But as far as how it would impact us long term, it has changed how the county is doing business. And I don't think we're going to be able to go back completely to the old way of doing business. Now everyone is thinking about how you can keep yourself safe, and keeping yourself safe, you're protecting other people as well.
Right.
And so we need to think about that when we have residents coming into our offices to take care of business with us. We want to keep them safe as well as our staff as well. So things that we have in place, some offices have barriers that separate them from the public, and we're going to see more of that. Some people are using staggered schedules, meaning some of the office comes in one day, some comes in on the other, just to lessen the amount of people who are possibly exposed to the virus. And so going forward, I can't see us going back to how we used to operate immediately. We're going to have to gradually get back to those things.
Dr. Brake, I don't know if this is in your area or not, but tell people the importance of stop throwing these gloves and masks all over the place.
Okay, great. Yes, so the mask and gloves that you use are disposable, which means they should be disposed of, then put in a trash can or some other type of incineration or other means of getting rid of them, not just putting them like on the ground. And I've seen where people have thrown masks away and those types of things. But they really are intended because, one, if you've come in contact with the virus, you don't know if it's on your mask or if it's on your gloves. And so we ask people to, when you're using these, please recognize that they are disposable. And when you wear gloves in particular, they should be disposed of. Because if you don't, just think about if you had on a pair of gloves and if you're walking around and you're touching different things, everything you touch becomes contaminated on that glove. So if you're at the gas pump pumping gas, when you finish pumping the gas, you can take those gloves off and put them in the garbage can. So you can dispose of them that way, but please dispose of them properly and not just pollute the environment.
Thank you very much. County Manager Jones, any closing words on remarks?
Well, thank you for having us, and we just want to again encourage our residents to keep each other safe.
Thank you very much. Dr. Bray?
Yeah, again, continue to follow the executive orders, and I would just say, even if the order is lifted, to just please maintain the public health guidance. Social distancing is important. Hand washing and all of those things is very important. And to please remember to look out for those who may need our assistance, our elderly population in particular, and also those individuals who have underlying health conditions that may need assistance. So let's, as Secretary Cohen say, let's stay home and let's help save lives.
A question comes to mind. I know you may not have all the numbers, and of course you're not the governor of North Carolina, but how do you possibly see this being lifted anytime soon? I'm thinking that it possibly will be lifted after this, maybe this is the way I'm looking. But I mean, what do you think, being an expert?
Well, I think the governor may start to lift.
Sort of in
But
those
again,
phases,
as Mr. Jones said, all of this will have to be a phase-in process.
Right.
So if he lifts it, it will be a gradual kind of return back to the way things were. But again, if he does that, then we still have to remain vigilant, and we have to phase in our process as well. So it doesn't mean we just all go out and go back to doing what we used to do.
So even after he introduces his phase, we also have a phase here in Warren County that you will unroll as well.
Absolutely, absolutely. And Dr. Brake is right in line with what we are thinking. And so we still want to encourage people to observe the stay-at-home order and wear your face mask and use the other mitigation techniques of keeping your hands clean and not touching your face in areas that can transmit the virus. But we absolutely will do a phased-in approach. We won't just go back 100% the way we were.
Okay.
Right. So this has changed us.
Okay. Thank you all very much for coming in and just leaving us with a lot of information that we needed to know. And as always, as you all get developments on what's going on with this, of course, you know that you're always welcome to. We really encourage you to sort of get it back to us and get it out there. So
Thank you.
Thank you.
thank you guys
Thank
very
you.
much. All right.